Welcome everybody to ChalkTalk. It's a new thing that we're doing here at the Jacob Center to talk about new inventive ideas that Jodie, or Pia, and I work on together. So welcome. Thank you for coming and joining us and enjoying us. And we're going to talk about the lip today. And Jodie's going to, what do you think about the lip?
So, Dr. J, I've been noticing so many patients coming in lately and they've really wanted to enhance their lip, improve fine lines around their mouth, and they've just noticed so much aging in this area. And one thing I've noticed with a lot of them is this distance here between their nose and the upper lip. It's quite long and it's actually aging them. So what do you think about that? Yeah,
it's a good point. I mean, we've drawn a nose and a lip area, and what I see is a lot of people with a big distance from their nose to their lip here. And that distance sometimes can be 20 millimeters or more, which is a really big distance. In real life, that's like that big. And that changes as we age, that gets longer and longer. So you don't see the upper teeth, the upper lip gets thinner, and of course more lines occur. So I recommend a lip lift. And a lip lift is a procedure where there's an incision underneath the nose, under here, which heals great. The tissue is removed from here, and then the lip's brought up. And so the distance gets shorter by quite a bit. And that really makes a big difference. So the lip gets bigger. So maybe you could just sort of draw that on there.
So that's a really great point. And I really think what would be good is we combine your surgical lip lift. You could do something like that first, and then I could go and enhance the lip with things like Botox and filler and skin treatments like peels. What do you think about that?
Yeah.
So we can go in once this beautiful lip is kind of brought back up here.
There you go.
And bring it here. Something like this.
Yeah, exactly. So what we're doing is we're improving the whole fullness of the lip and shortening the distance, which is really great. The other thing about the lip lift is that there's also a little incision right here, which really hides well, and some skin is removed here. So what happens, you get a bit of that lifting at the corner, because a traditional lip lift really only lifts the central part, but that frowny part is not always helped. So getting that little bit of improvement, I do that together, it works great. And then you come in and we do this winning sort of trifecta.
I love that.
With what the Botox goes in here. Where are you putting that in there?
So Botox is going to go all along the muscle around the mouth to help with vertical lip lines, right? Okay. So we want to soften the vertical lip lines, that pucker muscle, right? When you make a pucker. So place little bit amounts of Botox right above that upper lip. Then I love to go in and use a little filler sort of in that border of that lip, enhance it, sharpen it, define it on the bottom as well, in the body of the lip, right? Little natural enhancement and fullness. So we're really just giving the lip a nice finesse here. To top it off, we want to do a chemical treatment on the skin, right? I mean, there's so many patients that come in and they have rough texture, right? They want to smooth out these lines. So we want to go in and we want to peel the skin. So I mean, this is really a home run here, doctor. I mean, we're using that synergy, we're combining all these treatments, and I love it. I think so many patients come in, they're focusing, they don't know what's wrong, they know the lip is aging. They can't pinpoint that it's actually a distance problem first.
And you can't treat that just with fillers. To close that distance, you've got to do a surgical procedure. But that alone isn't enough. So together, this enhancement, or SynergyLip as we're calling it, I think is it's awesome.
I love it. And I know you too can also do a lower kind of lip lift, right? Is that right?
Yeah, you can also do an incision here and make the lower lip fuller too. So yeah, there's lots of cool options.
I love it. So important timeline for this, doctor. Are you thinking probably surgical lip first, change that anatomy, give them 2 to 3 months to heal, and then we can go back in and do these non-surgical treatments, Botox, filler, chemical peel, whatever that may be.
Yeah, that's a good timeline. So that way they've healed enough, but it's not that long a period.
Okay.
So they're happy that you're going to get those results, but then you finish it off a few months later. That's
Love
perfect.
it. Okay.